Hey everyone. So this week I want to give you, I guess, an introduction, an update for some of you on a theme that we are all in on across all of our services that I am involved with. So if you're in Profits Unlimited, you've got exposure to this particular theme through stocks like Exact Sciences. This is a great example. And that is the theme of precision medicine, which has a lot of different parts to it. And I was trying to make some notes here, and you can see it's just a big mess because there's so many moving parts when you actually try to break down the idea of precision medicine. So I'm going to try, if I get myself a little spun around, just cut me a break because it's a big idea that is revolutionary and is changing the world ever so slowly. And the first impact of it really we have seen with these phenomenal, incredible vaccines that Moderna and Pfizer BioNTech have delivered to us in record time that work in an unthinkable number of people relative to the previous generations of vaccines, which is the Moderna, BioNTech, Pfizer vaccines work in something like 90 to 95% of people. I can tell you, go back and research any previous vaccine. They don't even get anywhere near that. But let me get back to the subject of this video, which is precision medicine. So from the way we look at it, I look at it, precision medicine is really about two things. And the first one is the use of personal medical data to come up with sort of your particular reactions, day-to-day sort of fact pattern, if you will, of your health, which gets recorded over time by your interaction with your doctor, your physician. If you go to clinics, you go to hospitals, it's all being recorded a little bit at a time, which is now capturing your history, self-reported sometimes, but then also as a result of various tests that are being done, the results that are in there. And now you have a big data set, if you will, of your personal health, which now comes up with behavioral factors. In other words, what you are doing that may be causing things in your life to be problematic from a health perspective. Environmental factors, for example, where you live or what circumstances that you are being exposed to, maybe at work, maybe at home, maybe in something else that you do that are causing health issues in your life. And this is now something that a doctor can access to try and actually use to determine a diagnosis. And that is happening as a result increasingly through algorithms where things are scored relative to your data, because we can now look at the data of millions and millions of people, and there are patterns that repeat themselves for people that have common factors, that have common environments, that have common behavioral tendencies, or where people do the same things and then there are these same healthcare outcomes that occur. So this then allows for the creation of systems of diagnoses which are far more accurate than the old way where you talk, someone listens, and then relative to the exposure that they've had to someone like you that has had similar symptoms in similar circumstances, then the likelihood of a good diagnosis increases. However, if the person you're speaking to has never encountered your particular symptoms, then the likelihood of a misdiagnosis increases. So to reduce that, we need better diagnoses. And for that, we need more data, more information, more patterns to connect each other. And now we have a pretty substantial database of information as a result of the HIPAA Act that was passed, I believe, nearly 15 or 20 years ago. So we now have a lot of information where when a doctor is presented with a particular issue, there are actually lots and lots of precedents that they can look to determine what is the most likely symptom. And we are going to increasingly automate this as we introduce artificial intelligence into this, where it will sort through those factors and make that judgment. And already we are seeing that the diagnosis is far better than the old way. In other words, it has a 60 or 70% likelihood of getting it right versus a number that truthfully no one really quite knows. We've seen it at least in these few cases where people have gone and looked back, and it does look like the diagnosis is as much as 30, 40, in some cases even 70% more accurate. So that's a huge benefit to us as people, to get more accurate diagnoses so that you at least know and your doctor knows this is the actual thing that is wrong with you, or at least a higher probability of knowing that. The second element of precision medicine is the use of genetic data. So in the late 1990s, we decoded the human genome. In other words, we're all constructed as a result of various genes expressing themselves. And we decoded this, and we now have this where to the point where you can go to sites like 23andMe, and for about $100, you can actually have a lot of your genetic traits read and a report sent to you. And the price of this continues to go down. And the long-term benefit of this, and we're in the early days of this, I'd say like really in year 5, year 7. In other words, many people are still not really seeing it, not exposed to it. However, the long-term benefit of it is that when you combine it with an accurate diagnosis from what I was talking about earlier, and then you combine genetic data with it, the reality of genetic data is the vast majority of our genetic profiles, pretty much of people around the world, is pretty similar. However, the differences that are small are quite meaningful. And once again, when you go back and look at data and information and match these small differences to people's reactions, their side effect profile, how fast they recover, how much they recover, now you can start to create a system to actually accurately prescribe the right medication for each person relative to their genetic data. So that's the essence really of precision medicine. One, of using data and information and artificial intelligence, which is a fancy way of saying very, very sort of sophisticated analytical techniques to build algorithms to create better and more accurate diagnoses when you actually go to any healthcare facility. And second is, once you get that, is to actually get prescribed a drug that has the highest likelihood of working in you with the lowest side effect profile. And depending on how good the drug is, some drugs simply slow disease, other drugs are actually curative, that you actually get whatever it is that will actually help you in the best way, in the fastest way, with the least number of unneeded side effects. So many people will say, well, Paul, I don't know, this all sounds very sort of, I don't know, where no one really can tell anything. And I would tell you that people who dismiss the promise of precision medicine are going to miss out, whether it be from a healthcare perspective or from an investment perspective, which is that wellness is the essence of humanity. I mean, anyone that has gone through this pandemic and has been sick for any period of time knows that without healthcare, we have nothing. In other words, if you are not healthy, you can't really enjoy life. I mean, I know personally myself that when I used to live in New York, I used to be unwell, seemingly like for months in every year. When I had the flu, it would last weeks and weeks and would take forever. And gratefully, actually, since I've moved from there, I've been much more well more often, and I have definitely felt the benefit of that. I'm much more productive. I'm much more capable as a person by being well, meaning like I'm not constantly having a sniffling nose, or I've got a headache, or I've got all of these symptoms that are problematic. And it turns out that living in New York was a little bit difficult for me. However, I did not know that at the time. However, when we forfeit our health, we really are giving up a significant part of the enjoyment of truthfully just being a person or a human being. So the benefits of that right now are incalculable because we've never had that world before. However, imagine having a world where if you're diagnosed correctly, you can get a drug that can make you better quickly, or a diagnosis or some therapy recommended to you that can make you well better. How much that would do for us as a society, as a country, as a people worldwide. I mean, it would be mind-boggling. I mean, the impact per person is small, but it would be huge. The second thing, which many people will be like, well, now, Paul, you're starting to be a little bit more practical, which is that for the vast majority of people, actually, the first drug that they're recommended doesn't work. And anybody that has studied clinical trials is never surprised by this, which is that our standards, truthfully, for clinical trials are quite low. And if it works in something like 30 or 40% of people in the trial, most likely it's going to get approved by the FDA. And if we didn't have these standards, we would have almost no drugs. So the vast majority of drugs are not going to work in most people. So you're going to have to go through a trial and error process to figure out which drug is the right one for you. And, this is letting go of the issue of of misdiagnoses, which truthfully is something that until you had a big data set, no one could really go at that problem. However, the issue of drugs, of being forced to try a lot of drugs before getting the right one, has a significant problem, which is that the bad drugs may have terrible side effects, and some of those could be permanent. So having the ability to actually match the drug to you based on your genetics, based on your particular healthcare profile, has huge, huge benefits, which then goes to the next point, which is that healthcare spending, from being a fairly small part of most people's expenses today, is so big, and it's so huge, and is so controversial now. I mean, because a significant number of bankruptcies are driven by healthcare. Many people simply can't afford the drugs that are out there. So when you go and look at the combined sort of impact of misdiagnoses, people getting the wrong treatments prescribed to them, whether they be drugs, therapy, surgery, what you have is healthcare spending that is growing at a very, very rapid rate. I didn't look this up. However, I believe it's in excess of 30% of our economy today, which is a huge, huge number. And it's debilitating. In other words, for each of us to spend, let's just say, 15 or 20 or 30% of our incomes regularly on healthcare just to stay well, I believe in the long term is going to create a massive problem. So precision medicine really, really delivers, I believe, on solving a big and huge problem for us as a society, as a country. And the fourth one is something that many people don't think about, which is that as a result of all of these issues, we have government regulation that is very strict in terms of regulating the healthcare system. I know personally from having been an analyst on Wall Street covering biotechnology and pharmaceuticals, that the cost of developing a drug is just absolutely extraordinary. And precision medicine can really change that, because if you can select the right patients for those drugs and identify, hey, these are the patients that are going to be helped, and you give them the drug, and you now start to get success rates of 75, 80%, and where the benefit is like the vaccines from Moderna and BioNTech, Pfizer, where you're getting 95% benefit. Well, what you would then see is actually much wider access and cheaper, even if on a per drug basis they stayed the same, because you're starting to actually get what you actually need in terms of a healthcare therapy. So I believe that the promise of precision medicine is huge. And most importantly, it's undiscounted in an array of stocks, everything from molecular diagnostic stocks that many of you will recognize across our portfolios. And then increasingly as well in the pipelines of these companies that have recognized the potential of precision medicine are organizing their clinical trials around it, organizing their research around it, so that they are absolutely focused on that. And if you're interested in finding out what these companies might be, the easiest way to get started is to subscribe to our Profits Unlimited flagship newsletter. It goes for about $48, I think is the introductory offer. If you watch the ad, if you click on those strong hands above, it will take you to a 3-minute ad about Profits Unlimited, where we absolutely 100% laser focus on themes like precision medicine and others like it. All right, so that's the update for this week. I'll have another one next week. Until then, this is Paul saying bye.